10 क्वेश्चन मिलते हैं।
Sir, technology is very fast nowadays. It only takes 10 to 15 seconds to answer a question.
सर नहीं कोई
Are you ready to learn with fun? Brace yourselves for the ultimate test of knowledge in the Cardiac Super League. Witness the clash of giants as 12 formidable teams step into the arena, battling it out for cardiology supremacy. In this exciting collaboration between Wilson's Pharmaceuticals and the Pakistan Cardiac Society, the Cardiac Super League promises intense competition and groundbreaking learning experiences. Stay tuned as the teams showcase their expertise, strategic brilliance, and unwavering determination. Who will emerge as the true champions in cardiology? The main goal of the case-based learning approach is to equip students and healthcare professionals to refine their clinical practice by learning the latest advancements. The Cardiac Super League awaits you, guaranteeing to advance your education. Join us and become part of an incredible journey. Visit our Facebook page or contact us for more information.
Assalamu alaikum everyone, this is 𝐂𝐚𝐫 and welcome to Pakistan Cardiac Society's Cardiac Super League powered by Wilson's Pharmaceutical. Today once again we are live for the 7th match of Cardiac Super League, which is between Jinnah Eagles and MIC Panthers. And let me introduce today's senior faculty members available with us. Today, the umpire of today's match is Professor Mohammad Ishaq. He is Professor of Cardiology at Karachi Institute of Heart Disease. And we are very thankful for to Professor Ishaq for continuously being part of this Cardiac Super League as an umpire. And very soon, another council member, Professor Fawad Farooq, will also join us for this match. And moderator of today's program is Dr. Ashar Bilal. He is consultant interventional cardiologist at Karachi Institute of Heart Disease. And I will hand over the mic towards Dr. Ashar Bilal for moderating this match.
Thank you very much, Hamza. Good afternoon, everybody. So we are playing a 7th match today of Cardiac Super League. So I would like to first of all welcome to Professor Ishaq Saab, who is already joined with us, and I also want to welcome Professor Fawad Farooq as well, who is going shortly will join. Now, first of all, we would like to ask both teams to introduce themselves. So first, I will go with Jinnah Eagles to please introduce your captain and your team member to us. So Jinnah Eagles, please.
Yes, sir. I'm Dr. Junaid Babar. I am the captain of Jinnah Eagles. To the right with me, Dr. Zishan Alam.
Okay, thank you very much. Now I would like to move to MIC Panthers to please introduce your team members. Yes, MIC Panthers, please. Please introduce yourself. Hamza, I think they are not hearing me.
Yes, MIC
Panthers, are you hearing me?
Yes, we are hearing.
Okay, can you please introduce yourselves and your team member?
I am Dr. Muhammad Rafiq, resident, final year resident, FCPS Cardiology. I am the captain of the team, and with me, Dr. Farooq Masood, final year resident.
Okay, thank you very much. With this introduction, I would like to move on to the electronic coin toss. So I would like MIC Panthers to call on. So MIC Panthers, it's your call. You want head or tail? Yes, MIC Panthers.
MIC Panthers, I would request to please unmute your mic.
Yes, please. You want head or tail, please?
Tail.
Okay. Can we throw the coin, please? Okay, so it's tail. So MIC Panther, you won the toss. Now you have to tell us you would like to bat first. It means that you want to answer the questions, or you want to ball first. It means that you will ask the questions first.
I would like to ball first.
Okay, so you would like to ask the questions first. Okay, so now it's a batting for Jinnah Eagles, and MIC Panthers will gonna ask the questions to them. Okay, so Jinnah Eagles, are you ready for this?
Yes, sir.
Okay, so we hope that we will have a very exciting match today. So MIC Panthers, you can go ahead and ask your first questions, please.
Okay. A 49-year-old man with hypertension presents to the emergency department with 6 hours of severe substernal chest pain. The initial ECG shows 1 mm ST segment elevation in leads V1 to V4. He continues to have 6/10 chest discomfort despite nitroglycerin and morphine. On physical examination, his blood pressure is 110/60 with a pulse of 95 beats per minute, and S3 is present with rails halfway up both lung fields. The monitor shows 2 10-beat runs of non-sustained ventricular tachycardia at 60 beats per minute. The patient is started on lidocaine. What would be the next step in the management of this patient?
Okay, I think Professor Fawaz Farooq has joined us. We would like to welcome him as well. He is a professor of cardiology at National Institute of Cardiovascular Disease, Karachi. Welcome, Professor Farooq. Are you hearing us? I think your mic is mute.
Let's continue.
Yes, thank you, Dr. Ashraf.
Okay. Okay. So we are on the first question now. So please, MIC Panther, you can proceed with your question. What are your options now?
Yes. What would be the next step in the management of this patient? Immediate catheterization and possible PCI, IV beta blockers and IV Lasix with medical management, IABP insertion with medical management, pulmonary aortic catheter insertion with medical management.
Okay. The time starts now.
Option A.
Are you sure, Jinnah Eagles, because you have a lot of time and you can think more? You're happy that we should lock your answer?
Yes. Yes, sir. Please lock the answer.
Okay, that's fine. That's fine. Hamza, please lock the answer. Answer is A. Okay, let's see. Okay, that's the correct answer. Very good. 6 runs. I mean, you start your batting like T20. So that's very good. Okay, we'll move on to second question now.
Question number 2. Which of the following is associated with highest risk of cardiovascular mortality after primary PCI? Thrombosis in options are thrombosis in myocardial infarction, TIMI3 flow grade with normal myocardium, cardial blush or perfusion grade, transient no reflow, persistent tachycardia, TIMI1 myocardial perfusion grade.
Okay, timer start, please.
Transient no reflow है तो maintain हो जाएगा like 3 और persistent perfume grade highest risk more likely after कुछ होता है D तो D लग रहा है तो कंट्रोल हो जाएगा option D.
So please lock option D.
Okay, so you still have around 35 seconds. Are you sure? Continue, please. Timer should continue.
Sure.
Yes, sir, sure.
Okay, please, Hamza, lock answer D. Lock answer D.
D, sir.
Okay, very good, very good. Another 6 runs. So you're performing really good, your openers. Okay, now we will move to question number 3 now.
At the time of discharge, his echo shows ejection fraction of 35%. Which of the following drugs should be added in addition to dual antiplatelets, statin, and beta blockers. Long-acting nitrates, eplerenone, trimetazidine, and ranolazone.
Okay, time starts now.
nitrate applying करना पड़ेगा 35% और nitrate में नहीं लेकिन क्या पता है कि यूज होगी बताइए मुझे बोल दे
So please log option B, eplerenone.
Okay, Jinnah Eagles, are you sure?
Yes, sir.
Okay, so should we lock now?
Yes,
Please
sir.
confirm us. Okay, stop the timer and lock answer B. Very good, very good, fantastic. You are playing really good. Okay, don't disheart MIC Panthers. You will have your chances as well. So we'll go with proceed with the question number 4.
Yes. Which of the following among P2Y12 inhibitors is most associated with drug resistance? Clopidogrel, ticagrelor, prasugrel, 𝐂𝐚𝐫𝐿.
Okay, so okay, timer starts now.
drug resistance डॉक्टर आगे डिस्कशन कर रहे हैं
Okay, 48 seconds left. Okay, now 30 seconds left. Jinnah Eagles, for you, 30 seconds. Okay, 15 seconds left now.
Sir, option C, prasugrel.
Okay, we will continue. We will stop here now and lock the answer C. Answer C. Okay, wrong answer. So okay, no worry. We'll move further to question number 5.
Which of the following time delays in primary PCI is associated with highest mortality? Door to balloon time, door to balloon time minus door to needle time, symptoms to balloon time, symptoms to door time.
Okay, your timer starts now.
Basically, symptoms to associated with highest mortality. It should be symptoms to symptom to door time is symptom to balloon time. Symptom to balloon time होना चाहिए. लेकिन एक पेशेंट डोर पे आ गया, उसकी थोड़ी सी पेशेंट आ गया, तो करेंगे ना. टाइम सिम्टम पे बैलेंस मुझे लगता है जिसके अलावा कोई और चीज़ नहीं लगेगी. सिम्टम टू डोर टाइम सिम्टम टू बैलेंस डोर टू बैलेंस मुझे लगता है सिम्टम टू डोर तक मैक्सिमम डिले ना तो सिम्टम टू बैलेंस सिम्टम टू टाइम होना चाहिए. मरीज हॉस्पिटल आते थे डिले कर.
Okay, Jinnah Eagles, 30 seconds left.
डो टाइम कर सिम्टम डो टाइम सिम्टम्स डो डी. मुझे तो यही डिले है, बाकी हॉस्पिटल में आकर इमीडिएटली उसने कर देने आते हैं.
कर दूं फिर ऑप्शन डी.
Now 15 seconds left.
जी सर, प्लीज लॉग ऑप्शन डी, symptoms to door time.
Okay, we will lock the answer D and see what the results are. Answer D. They said
Non-technical.
You said answer C or D?
ऑप्शन हॉस्पिटल में वो आ गया
D for dog.
Yeah, they said the answer D, not the answer C. Please log the answer D.
Yes, sir. The right answer is C, option C.
Okay. It's in other way. Okay, that's fine. That's fine. Okay, so your answer is wrong. Okay, that's fine. So we'll move further to question number 6. Okay.
Question number 6. Regarding STEMI, which of the following is not true? Aspirin should be continued indefinitely in all NSTACS patients at a daily dose of 325 milligram. All eligible patients with NSTACS should be referred to a cardiac rehabilitation program. A P2Y12 receptor inhibitor should be continued for at least 12 months. Folic acid should not be used for secondary prevention in NSTACS patients.
Your timer starts now, Jinnah Eagles.
एस्पिरिन 325
Folic acid should not be used for secondary prevention.
is not true. Not acid should not.
So please log option A.
Okay, are you sure? Because you still have 65 seconds.
Yes, sir, we are sure.
Okay, so please log the answer A for Jinnah Eagles, and we'll see what's the true answer is. Okay, your answer is true. Very good. Once again, you hit the bullseye. Okay, now we'll move to question number 7. I'm just proceeding a little bit faster because we lost time at the starting of the game. So sorry for that, but we have to move quickly. Okay, question number 7, please.
As per AHA guidelines for management of ACS patients, which of the following drug is not recommended? Angiotensin converting enzyme inhibitors, beta adrenergic antagonists, immediate release nifedipine, non-dihydropyridine calcium channel blocker, sublingual nitroglycine.
Okay, your timer starts now.
Please nifedipine तो नहीं देते image release nifedipine एक देते हैं बीटा देते हैं सब देते हैं
ये camlodipine इसमें है ना non
I think Jinnah Eagles, you can discuss it loudly.
Yes, Jinnah Eagles, are you want to say something?
So please log option C.
Okay, you have 54 seconds left. So are you sure we will log answer C?
Ji sir, please log up option C.
Okay, we'll stop the timer and we'll log answer C. Very good, very good, very good. Okay, so with this, we will move on to question number 8. Yes, please read it out.
Regarding duration of dual antiplatelet therapy after STEMI, which of the following is true? For 6 months, for 12 months, for 2 years, indefinitely, not recommended routine.
Not recommended routine, ये गलत है.
Okay, your time starts now, please, Eagles.
मेरे पास 6 महीने के लिए भी देते हैं, 12 के लिए भी देते हैं, और अगर प्लेटिंग कम है तो आप indefinitely नहीं देते.
ये मेरे को मतलब ये होगा.
For 12 months, नहीं. Regarding duration of the following is true. Which of the following is true? 12 months. सही है. I thought कि which is not true. 12 months.
So please log option B for 12 months.
Okay, you have a lot of time left still. So please please reassure us you want to log the answer B.
Yeah, yes sir, please log the answer B.
Okay, we'll stop the timer and log the answer B, please. Log the answer B, Hamza.
मुझे लगा था
Very good, very good. With this correct answer, you reach on 36 runs, and with this we would like to move on to question number 9. Please, MIC Panthers, ask question number 9.
65-year-old history of TI
In a 65-year-old patient with history of TIE after STEMI,
is recommended.
following combination of dual antiplatelets is recommended: aspirin and epsiximab.
𝐂𝐚𝐫.
DIE after STEMI. Following combination of tablets recommended. Prasugrel to
Yes, you can read out your all options, please.
Clopidogrel, aspirin, and prasugrel.
Dual antibiotic.
So should we start timer now? Because MIC Panthers, just read your all options, please.
Aspirin and abciximab, aspirin only, aspirin and clopidogrel, aspirin and prasugrel, aspirin, clopidogrel, and eptifibatide.
Eptifibatide. Okay, we'll start the timer now.
Aspirin and clopidogrel. वो इसके अलावा कोई prasugrel नहीं है, नहीं है, abciximab नहीं देंगे, eptifibatide. बस ये.
So please log the option C.
Okay, are you sure?
Yes, sir.
I have to ask this for you because you know you are answering very quickly. So this is my job to offer you the time because there's a lot of time left. So are you sure? Just give us clearance, so we'll stop the timer.
Yes, sir. Please stop the timer and lock the option C.
Okay, we'll stop the timer and lock the answer C. Very good, very good, very good. Okay, so I think we are almost at the end and there's a final over left. So we'll move to the final over now. I mean the question number 10.
Regarding TIMI risk score in STEMI, which is not component of TIMI risk score. Positive cardiac marker, aspirin used within the last month, known coronary artery disease greater than 50.
Aspirin होती है.
Okay, now please don't speak, Eagles, please, until they finish the
greater than 0.5 mm.
Okay, your timer starts now. Yeah, you can take your time. You're performing really very good, Jinnah Eagles.
1 week है.
Is not a component of TIMI. To B.
Is not a B. हाँ B है. Aspirin तो 1 week, 124.
So please lock the option B.
Okay, so are you sure? Because you still have 43 seconds.
Yes, sir, we are sure.
Okay, so Hamza, please stop the timer and lock answer C. You said C?
B.
Sub option B.
Answer B. Okay, lock the answer B. Okay, very good, very good. With this, you will get, I think, 48 marks. Out of 60 marks, which is very fantastic and very good performance. Now with this, I would like to move. Okay, I would like to move to Professor Fawaz Farooq just to give his comments for the game which we played up till now. Over to Dr. Fawaz Farooq.
I think it was a real T20 because they scored eight sixes on 10 balls.
Yeah, you're absolutely right.
So I think Multan were very generous. They have made a betting pitch. Let's see how Jinnah bowled now.
Okay, so
to really save their score.
Thank you very much. And with this, I just would like to move to Professor Issa just to give his input.
Thank you, Ashar. First of all, thanks for a very nice moderation. And as Fawad has pointed out, Multan made a sown halwa for them, actually. It was having attended all the previous sessions. I think it was a quite a straightforward and simple questionnaire that they made for Jinnah Eagles. So I hope now the other side also is generous enough to give them a good score. I think it was definitely a betting pitch, and but yes, this is the way it is. And
Okay.
Congratulations to the team. I mean, 48 score. I think this is one of the highest score that we have seen so far in our tournament. So
Thank you.
I think well done, and let's proceed for the next
Thank you
session.
thank you very much, Professor Issa. With the council permission, I just want to add a little thing. I think the Eagles got very good points, but I think I would like to encourage MIC Panthers because their questions are very relevant and very practical. Because I saw in the previous matches, the questions are not really so practical. So, I mean, it's not a matter that you win or lose. It's just you need to spread the knowledge. That's what my impression is. Anyway, with this, I would like to move to the second innings, and now it's MIC Panthers who will gonna bat, and Jinnah Eagles will gonna ball to them. So, Jinnah Eagles, you can start with your first over now. Yes, please read it out.
Yes, sir. Differential diagnosis of pulmonary embolism is challenging. PE should be considered in the differential diagnosis of patients suspected of having cardiac ischemia, heart failure, COPD, exacerbation, pneumothorax, pneumonia, sepsis, acute chest syndrome in patients with sickle cell disease, and acute anxiety with hyperventilation.
Okay, so I mean, this is your scenario? MIC Panthers, is this Jinnah Eagles, is this is your scenario?
Yes,
okay.
sir.
Okay, so proceed with your question number 1 and relevant options.
So which of the following is preferred imaging technique for diagnosis of acute pulmonary embolism? Option A, VQ scan. Option B, duplex ultrasonography. Option C, CT angiography. Option D, echocardiography.
Okay, the time starts now for MIC Panthers. It's not clicking. The time is not clicking. Hamza. Yes, now. Good. So, MIC Panthers, can you 30 seconds left now? Can you open your mic and this because everybody would like to hear your discussion. I'm asking MIC Panthers, please. 19 seconds left. I think your mic is not open. Hamza, just check it. It's 11 seconds left.
Sir, they cannot
Hello?
answer.
Stop the question. MIC Panthers, 1 second left. I think they are waving us. I think something wrong with them. Hamza, please check it out.
Sir, I'm checking.
Yes, please check it out. They are answering. We are not. I think probably we are not able to listen this. Shall answer there, and we are not able to listen. I'm not sure what's going on. Hamza, are you able to hear from them, MIC Panthers?
I think something has happened to their mic.
Okay, we have to crack this first, so we will not gonna proceed further because they have to answer the questions. MIC Panthers, are you hearing me? If you just hearing me, just let us know.
MIC Panthers, आप अपने जो लैपटॉप का माइक है उस पर स्विच कर लें जूम के अंदर, आपकी आवाज आ जाएगी हमें.
Yes. Macaron.
हमजा इनको अनम्यूट कीजिएगा आप MIC पैंथर्स को, या उन्होंने अपने पास से म्यूट किया अपने आप को?
हेलो
Yes, is MIC Panthers?
जी जी, आवाज आ रही है सर?
जी, अब आपकी आवाज आ रही है। आपका तो 1 सेकंड रह गया है, आपको ये नहीं
जी
पता
सर,
आपने।
हमने 70 सेकंड पे ही ऑप्शन सी लॉक किया था, लेकिन आवाज ही नहीं जा रही थी हमारी।
That's fine. We understand. Okay. Still you have 1 second, so we'll lock the answer C. Answer C. Yes, option C. Please lock the answer C, Hamza. Hamza, please lock the answer C. Okay, this is the correct answer. So they start their batting similarly like Jinnah Eagles. So we'll move to question number 2, please. Okay, please ask the question.
Which of the following is highly sensitive for predicting the absence of pulmonary embolism and is used for the patients whose probability for PE is unlikely and who may need only minimal additional testing? A. VQ scanning, B. D-dimer testing, C. CT angiography, D. duplex ultrasonography.
Okay, time starts now for MIC Panthers.
जी सर, लॉक ऑप्शन बी।
Okay, are you sure? Because you have a lot of time now.
Yes sir, sure.
Sure. Okay, we'll stop timer here and lock answer B. Okay. Yes, it's a right answer. Very good. Very good. So we'll move to over number 3. Jinnah Eagles, can you ask the next question, please?
The oral factor 10A inhibitor anticoagulant can be used for both initial and maintenance anticoagulation therapy. These drugs are more convenient than warfarin because they have fixed dosing and do not need laboratory monitoring of their anticoagulant effect. Which of the following is a major disadvantage of these drugs? A. Virtually any new drug prescribed may cause an interaction with these maintenance drugs. B. There are no widely used drugs to reverse anticoagulation if bleeding occurs. Option C. These drugs can induce necrosis in the patient with heparin-induced thrombocytopenia. Option D. Clinically relevant bleeding in studies was higher with edoxaban, a factor 10A inhibitor, than with warfarin.
Okay, the timer starts now for MIC Panthers.
Sir, lock option B.
Okay, MIC Panthers, are you sure? You still have 60 seconds left. You can think again, and once you're sure, just let us know again.
Sure, sir. Option B.
Okay, so should we lock down option B? MIC Panthers, should we lock the answer B?
Yes.
Okay, okay. So we will lock the option B, please. Lock the option B, Hamza. Okay, the answer is correct. Very good, batting. I think I'm agree with Dr. Professor Isar that it is really a batting pitch. So we'll move to over number 4. Please ask the next question.
Question number 4. Following is a high-risk feature of pulmonary embolism. A. Heart rate more than 100 beats per minute. B. Systolic blood pressure less than 100 millimeters of mercury. Option C. Respiratory rate more than 24. Option D. Arterial oxygen saturation less than 95%.
Okay, timer starts now, please.
Sir, lock option A.
Okay, MIC Panthers, you are very quick. Are you sure we should lock the answer?
Yes.
Your
Sir.
answer? Okay, okay. We'll lock the answer A as you suggested. Please, Hamza, lock the answer A. Oh, it's answer B. Okay, I think it's better we should take our chances fully. Anyway, so With this, we'll move to over number 5. We'll move to over number 5. Please ask the next question.
Question number 5. Regarding 𝐶𝐸PH, chronic thromboembolic pulmonary hypertension, one of the following is true. Option A, there is an matched perfusion defect on ventilation perfusion scan. Option B, estimated systolic pulmonary artery pressure is more than 60 millimeters of mercury. Option C, when dyspnea or functional limitation does not persist in the clinical course after pulmonary embolism. Option D, permanent intravascular devices, malignancy, and essential thrombocytopenia are not risk factors for 𝐶𝐸PH.
Okay, your timer starts now, MIC Panthers.
B बनता है मैंने भी recent मुश्किल पे 60 से करता हूँ ये दोनों में होगा ना ये करवाते हैं ना वे कुछ क्या कंफर्म करना पड़ेगा जी सर लॉक ऑप्शन बी
Okay, MIC Panthers, are you sure you want to lock option B?
Option B.
Option, sorry?
B. Beta.
B, yes, that's what I said. Okay, so are you sure should we lock on your option B?
Option B.
Okay, we'll lock on option B. Okay, stop timer and lock option B. B for beta. Hamza, please lock option B. Okay, this is right answer. Very good. Another sixer, and with this another sixer, we will move to next question, please. Question number 6.
Question number 6. Regarding pulmonary embolism mortality, A reaches up to 20% when left untreated. Option B reaches up to 15% when left untreated. Option C reaches up to 8% even with early treatment. Option D reaches up to 4% even with early treatment.
Okay, your timer starts now, MIC Panthers.
Lock option D.
Option D, okay. D for Delta. Are you sure, MIC Panthers, we should lock the answer D?
Yes, sir, sure.
Okay, we'll stop timer and lock the answer D. D for Delta. Oh. Okay, so the correct answer is C. You still have a lot of betting left, 4 questions left. So I would just suggest MIC Panthers, just think twice and give your answer. No hurry there, okay? Consume your whole 90 seconds if you want. With this, we will move to question number 7. Please, question number 7.
Question number 7. Clinical significant pulmonary embolism arise in option A, ankle vein, option B, femoral vein, option C, calf vein, option D, popliteal vein.
Okay, your timer starts now.
So now just 4 balls remaining and 24 runs required. You can't miss.
Yeah, yes,
MIC,
they can't miss.
If you have missed even a 1 delivery, you will lose the game. So be careful now. You have time. Just take your time, and you can discuss your discussion even on mic. That really give live this program. You'll see what you are really thinking.
Yeah, I totally agree with Professor Fawaz Farooq that your discussion, we will love to hear your discussion. So we want 30 seconds left now. So would like to see that how you proceed and how you proceed with the question. So that's we would love to hear. Now,
option B.
Okay, 19 seconds left. Okay, we will stop here and lock answer B, femoral vein. Okay, We'll lock answer B here. Hamza, please lock answer B. Okay, right answer. Very good. Very good. Okay, so you save yourself for another day, and now you're still in the game. We'll move to question number 8.
3 balls
number 8.
remaining. 18 runs required. Yes, go ahead.
Yes, sir. Gold standard test to diagnose pulmonary embolism is option A, CECT, option B, VQ scan, option C, pulmonary angiography, option D, echocardiography.
Okay, guys, your timer starts now.
Just take your time, relax.
I think this
Go
question
through
has been
every
repeated,
option.
if I'm not wrong.
I mean, it's up to them. They can ask the question in different way, but
Option C.
okay. Panthers, are you sure we should lock answer C? Because you have
Yes, sir.
still 60 seconds. Okay,
Yes, sir.
as,
Lock option C.
okay, as you wish, and we are getting late, so we'll lock the answer C, and we'll see how does it go. Hamza, please. Ah, very good, very good. Okay, so you are still in the game. Very exciting. I'm really very excited now because it's 2 balls and 12 runs for equalization. So for tie the match. So we'll move towards second last over now. Move to second last over. Question number 9, please.
Ashar, it's balls, not over. So 2 balls remaining, and they have need to score 12
Doesn't
runs.
matter. It's 2 balls or
Okay. Okay, go
okay.
ahead.
Question number 9, please.
इसका आंसर शो हो गया पहले ही
सर क्वेश्चन नंबर 9 का आंसर पहले ही शो हो गया है
उसको पहले वो आ गया है हाईलाइट हो गया वो
Okay,
यहाँ
so
तो नहीं हुआ कुछ highlight.
no, there is answer showed. I agree. Okay, now what I will do, I will move to Professor Isaaq Saab. What my suggestion is to ask question number 10, and then this Eagles will make another question. We'll give them 5 minutes to make another question, and they will ask that the question number 10 later on. That's what my suggestion is. But I would like to move to Professor Isaaq because he is the umpire and he will decide what should we do now. Professor Isaaq
लेकिन
Saab.
इन्होंने खुद ये क्वेश्चन इंसर्ट किया है, तो let it go like this. I mean, we cannot create another question right now.
सर बेसिकली आंसर शो हो गया क्वेश्चन का आंसर शो हो गया
Yeah, this is I think this is mistake. It's not
This is
deliberate.
their mistake. This is their mistake, and they should be penalized for that.
Sir,
No,
this
I
is
don't
mistake
think
from
that
our
it's their
side.
mistake.
It's not
a
our mistake.
because-
Sir, honestly,
Yeah,
हमें
This is the
option नजर
mistake
नहीं
from
आया.
our side, sir.
Yeah,
It's a
that's-
mistake. Okay,
हमें option
from your
नहीं
side.
आया.
okay,
that's
guys.
fine.
Okay. It's a mistake from
फिर
our
ऐसा
side.
करें-
Hamza.
Ashar, please
अब आप
give
ऐसा
me a
करें-
minute. Ashar, please give
आप
me a
ऐसा
minute.
करें कि एक क्वेश्चन और लेके let them create another question just now.
Yeah, that's what guys. That's what I suggest, that we will ask the question number 10 and we'll
Cover
consider.
more,
Professor-
then they should do it.
प्रोफेसर फवाद फारूक कुछ कहना चाह रहे हैं प्लीज
Okay, Fawad, please.
Yes, please let. I think it's not an urgency because making questions just urgently is not going to be fair. But I personally feel, Hamza, if you have any question in your bank, because we have no really obligation for sake of any specific subjects.
Okay, that's fair enough.
Yeah. So if Hamza have any question in the bank available for future competitions,
नहीं फवाद वो मुनासिब इसलिए नहीं
He
होगा
can
कि
take that
वो
question
ये
from
कहेंगे
the
उसका
MIC
मुश्किल है ये. It should
no,
be
sir,
related to what they are already
every-
discussing.
Everything,
Decade, we are
everything is
focusing.
there. Either in other way, making question right at the moment would be, there's no validation for that question, so it will be difficult. We can defer. We can take this question later on. That's the 2 possibilities. Making question immediately and then asking without validation would be again raising question to the credibility of the whole competition. And there's a very critical in a way. Let's ask this question, because if they drop this question, they are already have lost the match. Then it would be any
that's a good idea. We will ask the question number 10 and we'll see if they are still in the game. Then we will we'll see how should we proceed. How should we supposed to proceed?
Agree,
Okay.
Ashar.
So we'll ask the question. we'll ask the question number 10 and then we'll sort it out this issue after this. Okay, so ask question number 10, please. Yes, please read it out loudly, please.
Regarding treatment for pulmonary embolism, following is true. A. Therapeutic anticoagulation more than 3 months is recommended for all the patients with pulmonary embolism.
Jinnah Eagles, you are not loud enough.
Yes, please. Speak loudly.
Yes, sir. Regarding treatment for pulmonary embolism, following is true. Option A, therapeutic anticoagulation more than 3 months is recommended for all the patients with pulmonary embolism. Option B, therapeutic anticoagulation more than 8 months is recommended for all the patients with pulmonary embolism. Option C, NOACs should not be used for pulmonary embolism. Option D, oral anticoagulation with vitamin K antagonist is recommended for 3 months in patients with antiphospholipid antibody syndrome.
Okay, your timer starts now. Panthers.
A very crucial question. Will make things easy for us as well.
The lock option A.
Okay, MIC Panthers, are you sure? Because this is your make or break answer. So we would suggest you again take your time and then give the
Asher,
answer.
I think once they have committed, locked, and go forward.
Okay, that's fine. But I'm just reminding them because they are juniors and they are excited.
They know everything because that will be
option A. Sure.
Okay, that's fair enough. We will stop the timer now and lock the answer A. Please lock the answer A, Hamza. Okay, so again, we are stuck now. That's what I was feeling, that we will stuck. So we are stuck now. Okay, so there are two. Okay, again, I mean, there are two options. Yes, yes, sir. Yes, sir. Yes, sir. Yes, sir. Go ahead.
Let me say something.
So we do have a question.
You do have a question?
Yes.
Hamza?
Yes, we do have one question, but it is not related to this to their case.
तो आप उनको दिखा दें अगर if they are happy with it.
Oh, but no. If we show to them, then it means they know the answer, and then they say, okay, we are happy. No, that's I think not fair.
नहीं आंसर नहीं बताएं क्वेश्चन बताएं.
Options बता देंगे तो.
Sir,
question बता दें कि would you like to attempt this question or not?
Oh yeah, that's right.
No, not only just to attempt, whether the MIC Panther would like to, or Jinnah Eagle would like to ask that question as well, because agreement of both parties is important. It's not just the party who's answering. So both are agreed. First, I think display it to the party who is going to ask the question. So I think that's important. Otherwise, we have no obligation for any subject, sir. So it's not an way. Just it's important for the asking party that are they agreed?
Let's project the question and ask both the parties if they are willing to take it or not.
Okay, just one point I would like to add. Hamza, please just ask the question. Mention the question, not the options. Don't show the options. Just mention the question, and we will ask Jinnah Eagles first. They would like to ask this question or not?
Yes, that's because if MIC is knowing the answer, they would love to have this question.
Yes, that's my point was. That's my point was. Yes. So Hamza, please just ask the question. Don't show the options. Don't show the options, Hamza.
So just need 2 minutes for this.
Okay. So we have 2 minutes now for wait for these questions, and for this, I would like to grab this opportunity and ask Professor Ishaq just to give your overall comments for today's match up till now.
ये आज एक नई interesting situation create हुई है. First of all, let me congratulate both the teams. Today we have seen a very practical sort of discussion and questions. We have 6 previous sessions, and I see it from this angle that today all the questions मुझे खुद भी आ रहे थे, क्योंकि last time बहुत सारे ऐसे sessions थे जिसमें हो सकता है फारूक को सब आते हों, लेकिन मुझे काफी क्वेश्चंस में मैं खुद भी कंफ्यूज और पजल्ड था. But this time it was quite a straightforward. We had a lot of controversial questions in the past, and today the both the sides have projected very simple इसलिए कि मुझे सारे क्वेश्चन मुझे भी आते थे, तो अगर मुझे आते थे तो इसका मतलब है कि वो काफी सिंपल थे. The other thing is that we have deviated from our standard practice of putting a scenario and all the questions related to that scenario. So इस दफा जो था थोड़ा सा each question was a little bit of its own independence. It was not entirely connected to the scenario. So that is another difference between the previous sessions and this sessions.
Okay, I would like to. Yes, sir. Yes, sir. Please proceed.
सर हमारा
So
स्कोर
we are ready,
48 है,
can we-
42 शो हो रहा है.
जी
जी।
9 क्वेश्चंस आपने आंसर किए हैं और 42 है, तो अभी एक क्वेश्चन आपके पास बाकी है. And
अगर
if
आप
you
वो
answer,
ठीक कर लेंगे तो आप ड्रा हो
it
जाएगा,
will be
और अगर
equalized.
वो आपका गलत हो गया तो देन
So, yeah, you
I
can
think,
tie the match.
नहीं नहीं हमारा
You cannot win the match anyway. With this, yes, Professor Isaf, please proceed.
आई थिंक अगर वो हमजा साहब के पास क्वेश्चन तैयार है तो प्रोजेक्ट कर लें.
Yeah, I
एक चीज
think.
मैं रिक्वेस्ट
तो
करूंगा
तैयार है question.
कि
I
this
think
is
we have time in between. If Jinnah Eagles want to make another question, they can make starting that as well, so that we have second option available.
Yeah, if they don't agree with the Hamza's option, they can make a
Question is
question
ready.
as well.
If you want to see question is ready.
Okay, Hamza,
Okay,
display the question.
please.
Please, Hamza, you can show the question to Jinnah Eagles, please. Okay. Okay, the question is door to needle time in STEMI as per AHA guidelines is. Well, I don't comment on this because
No, sir.
yeah, Jinnah Eagles, what would you like to ask the question?
Definitely no, sir.
Okay, it's very easy questions and yeah, and I thought that you will say no. Okay. So can you make
सर
a
उस तरह
question
भी
on?
बड़े इजी क्वेश्चन थे, वो तो अब जो बन गया क्वेश्चन आने दें.
No,
उनकी भी सारी
no, no,
blended चल रही थी.
It should be
No,
fair
dear.
enough. Okay,
Am I
Jinnah
wrong,
Eagles.
dear?
Jinnah
Let
Eagles.
me-
Okay, Fawad, please continue.
Yes, I think if Jinnah Eagles are not comfortable in making question right now, we can take time in the next match for like one question, because it would be unfair to make such a crucial moment, and we have
Okay.
just
I
feel
got-
it
I
as
got
like
your-
that we have a got rained, and we have one more day for final decision making.
Okay, I got you. Okay, I got your
Fawad,
point.
अशर, अगर दोनों पार्टीज इस बात पे एग्री करती हैं कि आज इसका डिसाइड हो जाए, तो आई थिंक लेट्स सी द अनदर क्वेश्चन इफ वी हैव गॉट इन द बैंक.
But I think no, sir,
Next-
it's
next
not the
speaker,
bank,
please
because
show me.
it's the right of Jinnah Eagle to make their question by themselves. So if they are not
bana le.
agreeing with the question, right
Sir,
now it will be
मैं-
difficult, maybe create. If they are agree with
Are
that,
you in a
Jinnah
position to
Eagle-
make it now?
Jinnah Eagles, please. Jinnah Eagles, can you answer us, please? Can you able to make another question on same scenario like pulmonary embolism? Can you make a question in 5 minutes?
सर एक्सक्यूज मी, एक मिनट, मैं MIC Panthers से बात करना चाहूंगा. सर फवाद साहब को मैं ये थोड़ा सा बताना चाहूंगा कि ये जो आज क्वेश्चन हमने किए हैं या जिन्ना वालों ने किए हैं, ये रैंडमली अलॉट थे, हमारे बनाए हुए क्वेश्चन नहीं थे. उनके भी बनाए हुए नहीं थे, हमारे भी, हमने जो बनाए थे वो शायद किसी और टीम को दे दिए गए थे ना. ये रैंडमली अलॉटेड क्वेश्चंस थे.
जी
तो अब हमारा तो यही है कि जो रैंडमली बने हुए क्वेश्चन थे वही होने चाहिए.
Okay, तो क्वेश्चन जो है वो रैंडमली बने हुए थे. So
हमारे बनाए हुए नहीं थे सर ये क्वेश्चन.
okay, so then with this suggestion, I would move again to Professor Isaac. I think we should ask the question.
Mentors. Questions were made by their mentors, by their captains.
अच्छा
जी
सर,
सर,
I-
बनाए थे,
अच्छा
जो हमने फॉरवर्ड किए थे वो हमें नहीं मिले, ये और मिले हैं हमें.
अच्छा
Okay.
अच्छा ठीक है, let me then go to the Hamza.
जी सर, इसमें मैं थोड़ा सा एक्सप्लेन कर दूं. एज पर द गवर्निंग काउंसिल एंड अप्रूव बाय द फिरोज साहब, हमने जो प्रैक्टिस चेंज की है फ्रॉम द लास्ट मैचेस जो पहले हो रहे थे और अब, वो ये कि जो भी केसेस हैं वो बजाय अब टीम्स बनाने के वो रिव्यू कमेटी बनाएगी, और हमने कुछ लोगों को असाइन किया हुआ उसमें, बिकॉज वी वर हैविंग प्रॉब्लम विद द केसेस जो कि बनाए जा रहे थे. जैसे साहब ने जिक्र भी किया कि वो केसेस जो है वो बहुत ज्यादा प्रैक्टिकल नहीं थे, और आमतौर पे उसमें एक प्रॉब्लम ये आ रहा था कि उसमें रेफरेंसेस जो है वो स्ट्रांग नहीं होते थे, जिसकी वजह से डिबेट बढ़ गई थी. So what governing council members and Firoz Saab has decided कि अब केसेस टीम नहीं बनाएंगी बल्कि रिव्यू कमेटी बना के देगी और टीम उनके आंसर करेगी.
ओके बिलाल साहब ये तो बिल्कुल मेरे ख्याल में दैट्स रियली गुड बिकॉज टुडेस क्वेश्चंस वर रियली प्रैक्टिकल एंड प्रैक्टिकल यूज. और आप ये देखिए कि क्वेश्चंस वैसे देखने में बहुत आसान थे बट मैच वाज सो मच एक्साइटेड स्टिल कि आप लास्ट क्वेश्चंस तक गए. सो आई थिंक दैट्स फेयर इनफ. सो अब सजेस्ट अब चूज ये करना है कि हमें बैंक.
Yes, let me explain now. Now there is one more lesson that we should have, then one or two extra question even during competition in our bank. If such situation arises in future, we have that question already in the
totally
bank.
Agree.
That will be the
That's a good point.
question asked.
That's a good point.
Second,
At least two.
Second, now I am clear that questions are not of that particular team who's competing in that. So in that situation, I think MIC point is right, that whatever comes from the bank, one we have declined from Jinnah, but whatever random check question now come from the bank, that should be asked. That should be now my decision. And
That's fair.
Is Professor Ishaq.
Yes, over to Professor. Yes, over to Professor Ishaq, sir.
I think we have made very valid points. We want to be very fair. Although this is not a question of life and death, we are all friends and we are all learners and they are all friends, you see, comrades हैं, कोई ऐसी बात नहीं है. But से healthy competition में ये चीजें हर एक का right बनता है. So what I suggest is that we will ask the Wilson Pharmaceutical, उनके पास जो बैंक मौजूद है, जो उन्होंने बना के भेजे हुए reviewers में से एक क्वेश्चन और आइडेंटिफाई करके हम नेक्स्ट सेशन में 1-2 मिनट का इनका टाइम दे देंगे और वो एक क्वेश्चन कर लेंगे.
So we have just identified another question. Do you want to see that?
Just a minute.
Yes, if we have got.
If you have identified, I think that would be the question because Jinnah, I think you will be agreeing that these questions are not of yours. So it's a bank question which were asked, so that you have to agree with.
Yes, Jinnah.
If we listen, Fawad, as a senior, if we think that is a valid and reasonable question, let's take it then.
Yeah.
Yes. Okay, Jinnah Eagles. Yes, I just want one comment. Yes, Jinnah Eagles, because otherwise you have to left all your activities for the next Saturday and just come here again and sit together again just for one question, which is really absolutely not worth it. That's what I feel. I think we should take a question from the bank and we'll ask. It's your luck. If it's an easy or a difficult question, it's your luck. So do you agree?
That question will be again from the bank as well.
Yes. So are you agree with this? Should we proceed, Jinnah Eagles?
Yes,
please
I think
answer us.
Okay.
Yes,
okay,
sir.
agree. So okay, Hamza, please put the next question. I mean, we are already very late now, so I have to move as well. Okay. So the question, the next question is, please, I will read for you. The following are the cardiomyopathies with predilection for both VT, just a minute, for VT and conduction block even before overt myocardial disease except. Okay, the options are, please show me the options. Hamza, can you show us the options? Okay. So the options are number A, sarcoidosis, number B, Check's disease, C, amyloidosis, D, ARVD, and E, giant cell myocarditis. So
I think in my opinion, and Fawad will agree with me, that this is a reasonable question. It's not very difficult. It's not out of context. I think they should accept it.
Yeah, I think in my opinion, it's a reasonable question. We'll start timer now. Please.
Okay, MIC.
MIC Panthers.
MICT की टीम का वीडियो नजर नहीं आ रही है.
MIC, are you there?
आप लोग म्यूट हुए में, आपकी वीडियो नजर नहीं आ रही है.
MIC,
are you with us? Just say okay. We will hold the timer here. MIC, just can you confirm to us? Are you with us?
सर वहाँ पे MIC के लाइट चली गई है।
MIC की
Okay,
light.
just hold the timer. Hold the timer.
Hold the timer.
Hold the timer.
Hold the timer.
Hold the timer, please, Hamza.
हमजा मोबाइल से कनेक्ट करा लें अगर यहाँ पे कोई प्रॉब्लम हो रहा है तो.
Even if they are not in picture or on Zoom, you can ask this because now we all have seen the questions. It's validated. Just ask them by means of your personal communication and get the answer. We'll see here where the answer is right or wrong, and then we'll end the session.
Hello.
But a very, very exciting match. And that's the true, really beauty of the competition. That we are getting a very good as the time passing. And right, today's questions were very relevant, very practical. And I think that really give life.
Fawad, you will agree with me that there were some repetitions as well. So
yeah, there are few things which were asked in different fashions, but they were there.
Same thing,
So,
yeah.
But overall,
Our
because
previous
questions were just
our
pure
previous questions are
recalls
very
of-
difficult.
Yeah,
And
they were
today
recalls of
was a bit
small
more
things,
easy.
and they were more practical. And previously, the team's objectives were to take the small prints out of different corners and ask a question which is so difficult that other team wouldn't be able to answer. But that really don't serve in terms of practical purposes. Your questions should be daily routine practices, and that help us all.
फवाद वो पहले वाले जो थे ना वो हमारे लिए थे.
No, sir, I believe it's the major initiative has been taken, and from the governing council and Feroz Saab, Ishaq Saab, आप लोगों की intervention है. There were two feedbacks coming from your side.
काफी डिस्प्यूट आ गए थे मेरे पास, तो मैंने इतनी रेफरेंसेस जो चेक किए तो एक क्वेश्चन के मोर देन वन ऑप्शन हो सकते थे.
बिल्कुल बिल्कुल.
So that becomes so difficult for somebody to choose from. So that's why I suggested that we should have non-controversial, जिसमें एक ही ऑप्शन appropriate हो. क्योंकि वो पिछले वालों में ये था कि दो तीन ऑप्शन उसके करेक्ट हो सकते थे. So it was very, very difficult. So I think those teams have done a very, very wonderful job by answering those, attempting those questions.
Hamza, do we have the answer from the team?
Sir, they are connecting.
मैं जरा सा कुछ इसमें
भी बता देगा आंसर.
Hamza, it's not obligatory to have if it's delayed. You can convey them question, get the answer, and display it in this.
ऐसे तो मतलब ये तो बड़ा ही
वो तो फिर फेयर नहीं होगा अदर टीम्स के साथ अगर हम उनको.
हाँ ये तो इतनी देर में तो
सवाल तो फेयर नहीं होगा. That will be not fair enough with other team.
Let them
Anyway,
give them 2-3 minutes यार.
हाँ सर मैं नहीं मैं ये कह रहा हूँ सर आपकी बात से मैं जस्ट कंटिन्यू करना चाह रहा था कि I mean एब्सोल्युटली जो पिछले गेम्स थे उनमें मेरी ऑब्जर्वेशन यही थी कि वो इतने डेप्थ और प्रैक्टिकली कुछ अनरेलेवेंट आंसर्स थे जो कि प्रैक्टिकली होते नहीं है. These और आप still you can see and everybody saw के practical questions के बावजूद the match was so much excited and went up till the last ball. So I think this is much better because it will spread the knowledge and that was our main motive is. So Hamza, please, did you get any answer from MIC Panthers because we are unable to see them in Zoom now. So please.
Sir, अभी तक उनसे राब्ता नहीं हो पा रहा मेरा.
Hamza, just call them.
सर इतनी देर में तो जो भी कोई सराउंडिंग में होगा वो उनको जवाब दे देगा.
जी सर प्लीज उन्हें क्वेश्चन नहीं अभी तक क्वेश्चन उन्होंने नहीं देखा. क्वेश्चन
ये क्वेश्चन वहां पे डिस्प्ले नहीं हुआ है.
पहले डिस्कनेक्ट हो चुके थे.
बिल्कुल.
और साहब ये लाहौर वाले जो है ना सराय की बेल्ट जैसे ऐसे ही करते हैं. ये लाहौर वाले जो है ना सराय की बेल्ट बेचारों का एंड मौके पे लाइट उड़ा दी उन्होंने.
सर ये तो वैसा ही हो गया कि आखिरी बॉल पे जो है वो 4 रन चाहिए और बारिश हो जाए और पूरा स्टेडियम जो है वो बैठा बारिश खत्म होने के इंतजार में.
वो तो अल्लाह की तरफ से होती है ना बारिश, ये तो उन्होंने खुद ही करा दी है कुछ।
सर पता नहीं, यहाँ तो लाइट भी लगता है, पता नहीं क्या। Anyway, okay, so I mean, but Hamza, we have to decide in next 5 minutes or maximum 10 minutes because I have to move. It's quarter to 3 now.
It's a very sensitive question because मुल्तान और लाहौर की बड़ी rivalry चलती है.
Ah, yes. South Punjab and Central Punjab, isn't it, sir?
Yeah, there's a bit of rivalry there, and so there was a lot of opposition when MIC was being built. कि भाई कोई जरूरत नहीं है, ये है वो है, लेकिन I think MIC has done a wonderful job in that area. And Professor Ejaz थे, he served it very well. हमारे पास होके गए थे NSUD से, so I think ये अब आ जाना चाहिए लाइट. फवाद साहब, आप फारूक हमजा साहब, आप फोन पे तो बात करके पूछें कि क्या पोजीशन है. कैन दे आंसर ऑन फोन?
अनफॉर्चुनेटली फोन पे भी राब्ता नहीं हो पा रहा.
ये तो कोई बड़ी सीरियस इशू हो गया है, कोई कॉन्स्पिरेसी है, क्या है?
हाँ सर, मेरा ख्याल है वो नेक्स्ट टाइम ही आंसर देना चाहते हैं. और दैट्स व्हाट आई फील.
तो
नहीं, ऐसा नहीं कर सकते कि हम उनको फोन पे डायरेक्ट जो है ना जूम पे ले लें और फिर डायरेक्ट क्वेश्चन फोन पे करके और उनको,
लेकिन कांटेक्ट नहीं हो रहा ना, फोन पे कांटेक्ट नहीं हो रहा ना,
नहीं उठा रहे.
we are unable to contact with them.
इनको आप पूरे सिस्टम पे ना लें, जस्ट फोन पे ज़ूम पे वो कनेक्ट हो और हमारे यानी इस वाले लिंक्स पे जो एक्सपर्ट्स लिंक है इस पे कनेक्ट करा दे.
सर ये तो ऐसा ही हो गया ना सर, ये तो ऐसे हो गया जिसको किसी को काम कराने के लिए पहले पैसे दे दो तो फिर बाद में वो फोन नहीं उठाता और ना आता आपका काम करने.
फवाद साहब, कोई प्रेस कॉन्फ्रेंस तो नहीं करने गए चले हो?
आखिरी वक्त पे इस पूरे कंपटीशन से ला ताल्लुकी का ऐलान ना कर दें कि हम इसका हिस्सा नहीं है.
अच्छा जी, let me use my discretion as a so-called umpire. Okay, let's call it a day. We will keep one question for them for the next time.
I think so.
Well done, both the parties. Congratulations to Jinnah Eagles for scoring 48 at the moment, but they have got one more ball to bowl, and only then either they'll be equal or one of them will be winner. So
thank you very much, sir. I'm totally agree with you.
With this, I would like to thank the worthy moderator. Was done a wonderful job today, and Fawad Farooq, whose presence is always a matter of pleasure and fun for us. I'm missing his company. Abhi hum wapas aayenge to inshallah we'll be in Quetta together. And Hamza and Bilal, all of you and these young doctors from both sides, well done. And I think I enjoyed the questions today and the way they were quickly answering, making it easy for us to listen and sum up. So I think well done once again, Hamza and their team and Bilal Sahab.
Thank you very much, Professor Ishaq. I just now move for the final words from Professor Fawad Farooq. Professor Farooq.
I think Professor Ishaq has already concluded. Just Hamza, wind up the program. I think so.
Okay, that's fair enough. Thank you very much, Hamza. Please wind up the program and inform them that we will ask this question before the next match, which is the next Saturday.
Okay, sir. I will be informing them, inshallah. And with this, thank you to all the governing council members, Professor Fawad Farooq, Professor Ishaq Saab, and Dr. Ashraf Bilal for participating in this program in Match 7. And with this, I think I will be signing off. And thank you very much, everyone.
Thank you.